In tonight's Health Watch, staggering new numbers show how many people die each year in the U.S. from antibiotic-resistant infections.
The results come from a CDC report that even has doctors worried. Dr. Max Gomez has more.
I feel enormous loss.
Christian Lillis still struggles with how his mother Peggy died. 9 years ago, she was prescribed antibiotics for a root canal. Days later, she died from C. diff, an intestinal infection that can occur after using antibiotics.
I don't think you can absorb that kind of loss all at once.
C. diff is one of the CDC's top 5 urgent antibiotic resistance threats. 18 germs in total are listed in the new report, which finds antibiotic resistance leads to more than 3 million infections and 48,000 deaths each year.
Ultimately, we all want to avoid getting an infection in the first place, but if we do get sick, we want to make sure that there's an effective treatment for us.
Overuse of antibiotics is one cause of drug resistance. The CDC says hospitals have made significant progress in preventing infections, but more work is needed.
We need to improve infection control. We need to improve sanitation. We need to improve the way we use antibiotics wherever they're used. And we need new drugs.
Dr. Priya Nori runs a program at Montefiore Health System that monitors antibiotic use. She says patients should always ask questions about prescriptions.
Are there any alternatives to the condition I have, or are antibiotics absolutely the answer? If so, well, what is the shortest, most effective duration that I can take those antibiotics?
Still, doctors point out that there are times when antibiotics are necessary, even life-saving. They say that patients or parents of sick children often want antibiotics for conditions like viral infections that antibiotics are not effective against. As Dr. Nori advises, ask your doctor if you really need an antibiotic and what's the shortest effective treatment course for your condition. In addition to cutting back on antibiotic overuse, the CDC says we also need new vaccines, better tests, and other tools to combat the problem so doctors can better treat patients or prevent infections in the first place. Dr. Max Gomez, CBS 2 News.